There's a mewing craze taking over the internet. It's touted as a cure-all way to snatch your face and jaw without any surgery. And the best part is, it's free! Is mewing a miracle shortcut to reshaping jaws and improving teeth? Or is it just another fad designed to claim your eyeballs and steal your digital attention? Let's find out. Mewing is named after the Mews, a father and son orthodontics family from the UK. Mewing supports chewing more and elevating your tongue towards your palate to support the midface. They talk about the inner U, which is the impact of the tongue, and the outer U, which is the effect of the jaw. The most accepted technique to mew, as seen in many TikTok videos, is to place your tongue flat on the roof of your closed mouth and exert slight pressure on your palate without touching your teeth. Also, when swallowing, you should maintain this tongue position to the best of your ability and train your tongue to push fluids and food back, not using the sucking motion many of us use to swallow foods and fluid. Now, many people also include jaw exercises meant to build up the masseter muscles, even employing dog chews such as the dog Kong. But to truly understand mewing, we first need to understand what orthotropics is. Their main theory is that facial form is under environmental influence. Over time as a species, we've started to eat softer foods, and that has led to less mastication or chewing, which then leads to weaker muscles in the face and a less square jaw follows. Also, a change in our oral posture has led to reduced nasal breathing. And to adjust for this, we then have our tongues down, jaw down, lips apart, and our face becomes more vertical. Also, due to the effects of reduced breastfeeding, we have developed a weakened swallow. They speculate that all of these things have led to a downswing in facial form and our face becoming more narrow. There is now less space for our tongue, teeth, and airway to coexist. And this leads to various problems, such as crooked teeth, such as a restricted airway, which can result in obstructive sleep apnea, and reduced nasal breathing. They call this phenotype craniofacial dystrophy. And the Mews, with their orthotropics, are looking to create an upswing in facial form, using various preventative strategies, including mewing. They do acknowledge that you're more likely to see these changes in the facial anatomy if you start these preventative strategies earlier in life. Orthotropics differs from the mainstay discipline, which is orthodontics. Orthodontics is the traditional approach of aligning teeth. They consider the growth of the face to be relatively unchangeable in adulthood. Orthodontics involves mechanically pushing teeth into alignment through the use of braces and removable appliances. To provide the necessary space, orthodontics extract teeth or pull teeth backwards. In severe cases, surgery might be needed to cut the jaw and realign it. And retainers might be needed on the teeth indefinitely. Think Invisalign and similar types of appliances. Orthotropics, on the other hand, aims to be a preventative method that tries to get to the cause of malocclusion. It involves aligning teeth through natural growth guidance, which is an early prevention. They also believe in non-extraction and non-surgical methods. Treatment consists of guiding facial growth naturally through muscle strengthening exercises, posture improvement, and non-intrusive, discrete orthotropic appliances. In orthotropics, they claim more permanent results without a dependence on appliances long term. Now, there is no head-to-head longitudinal study comparing these two different methodologies. The establishment is orthodontics, and they often question the legitimacy of orthotropics. And it has been this way for decades, ever since Dr. Mews was pushing the orthotropic methods. The main message from orthotropics is that one's facial appearance is not fixed and can be changed over the course of one's life. They give examples of patients who've had strokes in the past, and not only do their muscles get weaker, but also the underlying bone gets weaker as well. When I was reviewing some of their beliefs, one thought I had was when we inject Botox into the masseter muscles to try to reduce the muscle size, what often happens is that the underlying bone can thin out as well. And conversely, when we strengthen our muscles through various exercises, usually the underlying bone also gets stronger. So perhaps they are onto something. So despite the controversy with orthotropics, I do understand the appeal. We all like the idea of rewarding hard work. If you go to the gym a lot and you're working out and you're eating healthy, you want to believe that you're gonna look and feel better. Also, these exercises are practically free as long as you don't count the time and effort that you're putting into them. And the trend that you are seeing on TikTok is relatively harmless. Unless you're consistently pushing on the back of your teeth, you're unlikely to cause a lot of damage. And fans of mewing say that it works to reshape the jaw over time, making it more snatched and giving it that model-esque type of look, or sometimes a more masculine look. People love the idea of self-improvement, a DIY way to improve our face and neck. So here are my thoughts on orthotropics and mewing. Exercises started early in life, like let's say in our teenage years, might help shape the way that our facial skeleton develops. But most facial skeleton growth is over by the age of 16, with some very small incremental changes that might occur up until the age of, let's say, 25. So the ability to change our faces with exercises greatly diminishes after the age of about 16. Over chewing can hurt the TMJ, and it can potentially lead to early signs of arthritis. So every time people are using that jawcercise type of device, or they're biting down on those dog kongs and they're trying to strengthen the muscle, they're also putting a lot of impact on the TMJ, and that could be harmful over time. Nasal obstruction and obstructive sleep apnea are often caused by factors that are far beyond just an unfavorable tongue position. When it comes to nasal obstruction, things like enlarged turbinates, septal deviation, various masses that can exist in the nose, also cause nasal obstruction, and obstructive sleep apnea has a lot to do with other factors of the pharynx and overall body habitus that go beyond just tongue position. And that obtuse cervical mental angle that you see on some people is often caused by the positioning of the hyoid bone. Instead of being positioned superior and posterior, the hyoid bone in some people is positioned more anterior and inferior, and that is sometimes what leads to that obtuse angle. Also, some people have more subplatysmal fat, and that too can create that heavy neck appearance. So it's not just the lack of jaw definition and tongue position that causes that heavy neck. And we know that through procedures such as deep neck surgery, that by removing that excess fat and by resculpting some of those muscles, you're able to get much better definition in the cervical mental angle without having to do any type of jaw exercises, with much more dramatic impact of any jaw exercise. I think that there's a danger in relying on mewing or other similar exercises to change the appearance of our crooked teeth, or to correct obstructive sleep apnea, or even to create any significant cosmetic change, because we become reliant on that type of exercise to do the things that we wanted to accomplish without truly seeing significant gains over time. So people can spend decades on this stuff with minimal to no change. And this is especially true when they start in their adult years. So if it's something like a cosmetic change, then okay, if you didn't see much impact and great results, then that's fine. But if it's something like obstructive sleep apnea and you're waiting for mewing to correct that, that can be dangerous because of some of the long-term effects of obstructive sleep apnea. So seeking more traditional routes that will more likely get you results, such as like a CPAP machine, is probably in your best interest compared to just waiting around for results of mewing. The viral videos showing immediate results are almost certainly fake. There was recently an article in Allure that discussed deceptive imaging in plastic surgery and how it's easy to fake results just by changing angles and lighting, for example. By the way, if you're looking for a plastic surgeon for a specific procedure, make sure to check out the list at Feel Confident, the beauty expert experts section. These are people who have been handpicked for their outstanding outcomes and reputations. I think mewing and orthotropics in adulthood gives people a false sense of control over their facial anatomy. So in conclusion, I think early on in life, orthotropics and mewing might have some impact in the way that our facial skeleton develops. But as we age, the potential for improvement drastically diminishes.